In today's video, I'm going to teach you how to update a treatment plan in SimplePractice. We'll walk through exactly where to click, what you can change, and a few practical tips to keep your documentation clear and compliant. This is helpful anytime a client's goals evolve, symptoms change, or you're preparing for a routine plan review. Start by logging in to SimplePractice. From your main dashboard, head to the Clients tab. Select the appropriate client and open their overview page. This is the hub for core details and documentation. On the overview, look for the section labeled Diagnosis and Treatment Plan. If there's already a plan on file, move your cursor over that area to reveal editing options. Depending on your view, you may either see an edit button or a small pencil icon. Click that to open the plan for editing. Inside the plan, you can revise any field that needs to be updated. For the diagnosis, make sure the codes and descriptions reflect the most accurate clinical picture. Update goals so they're measurable and realistic. Think in terms of what the client can accomplish within a specific time frame. Objectives should break those goals into smaller, observable steps. For interventions, list the approaches you're actually using, such as CBT techniques, exposure work, or skills training, and tie them back to the objectives. Adjust dates to reflect when the plan starts, when you expect to review it, and any target dates for milestones. If your workflow uses reminders, set them to prompt timely check-ins and updates so the plan stays current. As you edit, keep your language clear and behaviorally specific. Phrases that describe frequency, duration, and measurable change help demonstrate progress over time. If you work with payers, align with their requirements for goals and timeframes. Be sure not to include any sensitive details beyond what's clinically necessary. When you're satisfied with the updates, click Save or Complete and Save. Save will record your changes. Complete and Save may mark the plan as finalized, depending on your settings. Before you commit, give everything a quick review for accuracy: diagnosis, goals, objectives, interventions, dates, and reminders, so the plan tells a coherent story of treatment and expected outcomes. After saving, you'll return to the client's overview page, where the updated diagnosis and treatment plan should now be visible. That's all there is to it. By following these steps, you'll keep treatment plans accurate, timely, and useful for both clinical decision-making and required documentation. Thanks for watching, and keep your plans current to support consistent, effective care.